Ebola is one pandemic that has created an international health risk since its outbreak in West Africa 6 months ago. With over 9,000 cases and 4,449 deaths recorded, the ravaging impact of this disease in worst-hit countries like Sierra Leone, Liberia, and Guinea reveals how devastating the EVD is. At the Nigeria-South Africa Chamber of Commerce breakfast meeting for October, the impact of the EVD socially and economically in the West Africa region was brought to the fore with a presentation by Dr. Adeola Majiyagbe on behalf of Dr. Abdul Nasidi, Project Director, National Center for Disease Control.
One of the early responses of health workers was to actually run away from caring for the Ebola patients because, of course, knowing the high incidence of health worker fatality, and they were not trained. But as training was instituted, more volunteers came in, and none of those volunteers actually have been infected. Lessons learned. One is that there is no alternative for adequate preparedness. States have to be ready at all times. Like I said, it's not yet Uhuru. We cannot say because we've not had any new case of Ebola and that we'll never have again. States have to be ready at all times. And what will happen if a case was reported today? The Lagos State's preparedness situation was that, yes, they were lucky they had the infectious disease hospital, but the Commissioner for Health and his special advisor literally had to keep vigil for the construction of a new Ebola facility where all of the persons were now transferred to. So what will happen if a case was reported today is there isolation facilities, and Emergency Operations Center is the most essential in response. And then fear can slow response, as we'll see in the social and economic impact. Behavior issues are actually also complicating the impact of the epidemic. So fear can slow response, the health worker fear and the public fear. There's a lot of rumored misinformation, spreads fast, and we could see the role of the traditional healer in actually spreading the disease, saying that he could cure, or it was actually a woman that she could cure Ebola.
Dr. Adeola Majiyagbe speaks further on the Ebola pandemic and the containment measures required in the areas of developing viable infrastructure for public health institutions in the affected countries and the funding that is required.
I think what we can learn is that we have to have a high index of suspicion in institutions, particularly health institutions, and a high level of awareness in the public, as well as a preparedness plan to actually be able to roll out, indeed, if any Ebola case is discovered. I think that what has helped Nigeria is that we're used to, or we have those institutions that are already built for surveillance of communicable diseases like polio and other diseases of public health significance. So in the US, where those infectious diseases might have been controlled, the suspicion index might not have been that high. You understand me? And so I think there's a lot of learning to be taken from those processes that have been put in place in terms of setting up an Ebola Emergency Operating Center and actually having a structure in place to do the surveillance, to do the case management, and actually to have the preparedness plan. Indeed, if any case is detected, because for countries who do not regularly deal with infectious diseases, it could be a learning curve for them. What has helped us, like I said, in Nigeria is that we already have these platforms for dealing with things like polio and other infectious diseases. So I think there's a lot to learn also from coordinating the response from the federal level, from the state level, and other agencies as well. There's a lot to learn from early notification of the appropriate authorities. And generally, just putting public health containment processes in place, which when you come to a developed country who does not regularly deal with infectious diseases, those things might not have been so well defined. So I think that for the US and other developed countries, there's a lot to learn from having more like a disaster preparedness plan for this kind to have these kind of situations brought under control and having a high index of suspicion, because it's a global. The world is a global village, and things can happen anywhere.
The Ebola pandemic is scary and frightening. Hence, the call for a global effort has become necessary and essential to ward off a mass-scale disaster.